Assalamu alaikum. Assalamu alaikum, Dr. Abdul. I'm just going to share the live. I'm going to do some basic live support for the new followers. I'm going to go through the steps of basic live support, inshallah, tonight. If you want to join, you're welcome to join on the side and we can talk through it if you want. Let me know. How are you? Hi, Ray. Thank you for joining the live. I'm just going to put the camera down here for a second. I'm going to wait till more people join and then I will start basic live support. I've got my dummy here ready. Okay, so I just want to say thank you to all the new followers. And I hope that this live goes well and you learn something about basic life support. Thank you for liking the live, Dr. Abdul. I can see you're clicking away there. I'm also clicking away too. I'm going to try and share it to some people so who might want to join. Some people are live already, so they may not want to join. Okay. Get all my moderators. There we go. So how is everyone today? How has everyone's Wednesday been? Anisa, assalamu alaikum. Thank you so much for liking the live. If you can share the live, then we can get more people on here and we can do a bit of basic life support. I've got a presentation as well. So hopefully, inshallah, we'll go through all the steps. If you already know it, that's fine. You don't have to watch. But if you feel that you want to have a recap, that's fine too. So we're going to do a recap on basic life support, guys. Chest compressions and rescue breaths and, you know, all that kind of stuff. So let's get people on the live. Tell me where you're joining from. I am in the UK. Thank you for liking the live, Zainab. My twin friend, my twin name person. Assalamu alaikum, Mariam. Assalamu alaikum, Mina. Thank you so much. No gifts, guys, on the live. This live is not for gifts, okay? As long as you learn something and you gain something from this live, that'll be a gift enough for me, okay? Scotland! Anissa, wow, we have Scottish people on here, wow. You know, I've never been to Scotland. I'd love to go to Scotland. I've heard it's very beautiful, and I know if Saf joins a live, he'll tell us that he travels to Scotland quite a lot. Ayana, Blue, Tina, thank you for joining, guys. If you can share the live, we're going to be doing basic life support. I'm just going to show you the front of the presentation so you can see. Let's have a look. What we're going to be doing today or this evening. So we are going to be doing basic life support. And I'm going to go through this presentation with you guys and go through the steps of what to do if you see that someone has collapsed. Okay. If someone's collapsed on the street, how are you going to approach them? So we're going to be doing that today. But I just want to wait until a few more people join because I really want to reach as many people as possible. Okay. Thank you for sharing. Whoever's sharing the live, thank you so much. I'm just going to see if I can share it a bit more to other people. Let's see. Okay, and I'll share it with. The thing is, it doesn't give you the option to share it with more than a certain number of people, does it? Hopefully, share it with myself. Okay, so let's get as many people on here. Walaikum assalam. How are you? Oh, it's lovely to see everybody who's joining. Inshallah, this is going to be a really good live, guys. We're going to be going through how to approach someone who is collapsed. I'm just going to switch the camera back because sometimes what happens is if you're not engaging with the camera, TikTok suddenly pauses the live because they think that you're not doing anything, which is a bit annoying. But I'll show the presentation intermittently as well, and we'll be going through what to do when someone has collapsed. Okay. Has anyone been in a situation where someone has collapsed and they've had to do basic life support? Alhamdulillah. Or has anyone had any training in basic life support? Oh, alhamdulillah, Farzana, I had a good day. I was on call today, which is always fun, as you know. Thank you, everybody. So, I normally do this for age 9 and over, and I'm hoping to go into other places like mosques and things like that as well, to teach. Gosh, no, but I've had training at the hospital. Oh yeah, you know what? Everybody works in the hospital. Even receptionists will have had training in basic life support. It's so simple. When I do the courses for children, I teach children aged 9 and above, and yeah, Dom, yeah, exactly, and at the GP. So he's 10 years old, and if you have a look at my Farzana, no gifts. If you look at my profile, you'll see that my son is actually running the demo. He's 10 now. It's that simple. And I've also got, it's not hard at all, and I'll show you exactly what you need to do, and we'll go through each step by step. I've even got the trainer AEDs, and I will be walking us through how to use an AED. Absolutely simple, guys. This is the trainer one. Obviously in real life you got to be a bit more careful with it, but it talks you through it. It's got 2 buttons only, on and for doing the shock. That's it. But we'll talk through that as well. Okay, it's all going to be quite simple, guys. Very simple. Okay, thank you for joining, Sarah. If you can share the live, guys, that would be amazing. The number of people, the more people we have on the live, the more people that we can reach to do basic life support. Let me know when you're ready. Dr. Abdul, how are you? How was your day? Were you locum in today? Please follow Dr. Abdul, guys. Please follow Muslim Women Issues. Please follow. These guys are amazing. Any help on pernicious anemia? I think today, guys, I'm not going to do too much about medical issues in that sense, because I want to focus on the topic of basic life support. I do a live in the morning around 8:30, just for 20 minutes before my day starts. And usually people ask me medical questions at that point. Okay. Wa alaikum assalam. Okay, thank you for the follow. Thank you so much for the follow, guys, and the likes. Okay, I think we've got how many people now? 32. Right, are you ready? Okay, so someone has collapsed, and I do want interaction, okay? I want people to write in the chat what, because I can't really see, I have to keep bending over because I can't see the phone. But if you see somebody has collapsed, what do you do? What's the first thing you do? First thing. Someone write on the chat, what's the first thing you do if somebody collapses? Thank you for the follow, but I want answers. Call for help, yeah. Absolutely. Everybody's got a phone nowadays, everybody. So call 999 straight away. If somebody's collapsed, you call 999. And then what do you do? So yeah, the Bussum, we're going to check breathing in a second. Nav, we can't put them on their side yet because we don't know what's caused the problem. Have they collapsed because they've had they've been hit by a car? I don't know. Something has happened. This person's collapsed. So what you do then is you call for help. Call 999 on your phone, and then you approach them. However, check for safety. If they're on a busy road, there are cars going by, I would not approach that person, because then you could put yourself in danger. Okay, you should make sure that you're safe, that there's no electricity and fire around, or if they're still being hurt, say for example they're collapsed but they're being attacked by somebody, you're not going to approach somebody like that. So your safety is paramount. If you put yourself in danger, there's no point. So once you know that they're safe, then you approach them. And, you have to check for response. Okay, yeah, Nav, splash water on their face. What if you don't have any water? You're in a desert or something. Okay, so you check for response. Usually what they teach us in basic life support is that you shake the shoulders. You go, hello, can you hear me? Can you hear me? And you really shout to check for response. Now, they could be someone who's asleep. They decided to sleep, in the street. I don't know. That could happen. And they might wake up, they might be drunk or something, and they might wake up and respond to your call, but they might not. And then what do you do? If they don't respond, what do you do then? And someone has mentioned it. Someone has mentioned what you do if they're not responding to you, pressing their shoulders and saying hello. What do you do then? A soft snap. Now, I think, yeah. So then you check for breathing. Okay, so the way you check for breathing, now when someone has a collapse, they're in cardiac arrest, okay, their muscles are all relaxed, and the worst muscle to relax is your tongue. So when your tongue relaxes and you're lying flat like that, it's going to hit the back of your back of your neck, and it's going to block the airway. And in order for us to open and push the tongue forward, pull the tongue forward and unblock the airway is by doing the head tilt, chin lift, okay? And you don't pinch the nose, hardcore, you don't pinch the nose. So how do we do head tilt, chin lift? So bear in mind, if you know that there's been no like fall or injury in the sense they've not fallen from a massive height and their neck is not compromised, you do head tilt and you do chin lift. And by doing a chin lift, you are bringing that tongue forward. I will show you on the presentation what that means, okay? Then you put your chin, your cheek next to their mouth. And what you're going to do is for 10 seconds, check for breathing. And you're going to look for breathing on the chest. So is the chest rising and falling properly? Can you feel their breath on your cheek? And can you hear as well? So for 10 seconds, you're looking, you're listening, and you're feeling for breathing, okay? And say that happens, what if they're not breathing? What do you do then? What do you do if they can't hear, feel, or see any breathing? Hi, Mitch. What do you do? Yes, exactly, Rosie. Oh, I don't know, I can't throw sweets or anything. That was amazing. Yes, CPR, okay. However, there's something else I wanted to put in here, is something called agonal breathing. Does anybody know, and I said it on the last live I did last week, what is agonal breathing? Yes, you start CPR. But before we do that, there's something, 40% of people that go into cardiac arrest will start doing a weird type of breathing called agonal breathing, okay? Oh, right, okay, Rosie, you need to do CPR, especially if you work with children in school. I think that is important. So agonal breathing is when the person takes a breath in and then they stop breathing. And then they're like, and then they stop and then they breathe again. That should be, you should assume in that situation that they're not breathing properly at all, and you would still start CPR, okay? So agonal breathing is as good as not breathing. Okay, then with actual CPR, guys, now before I do that, I'm going to go for the presentation because I want to kind of recap a little bit so that we're all different for children. Yes, it depends on how old the child is as well. Okay, guys, 2 seconds. I'm going to flip the camera up. So this is the presentation that I give the children, all right? So essentially, I always say, what is CPR? Now, I know a lot of us know what CPR is. It's cardiopulmonary resuscitation. So cardio means heart, pulmonary means lung, and resuscitation means to bring it back to life. Then we also say, what's an AED? So an automated external defibrillator, and I will go through that in a second. So a sudden cardiac arrest, I haven't asked that question. What is? Can someone describe what is a sudden cardiac arrest? What does that mean? Can anybody tell me what that means? Oh, Moody Muslim, do not send me any gifts, please. That's very kind. But I don't want any gifts. So, when someone is, doing a burglary, like robbing a bank or something, the usual. So Taz, I'll tell you. So what happens is, if a police officer comes and arrests that person, they've stopped them in their tracks from carrying on with the burglary, isn't it? So a cardiac arrest is where the heart just stops, and it's not a heart attack. A heart attack can lead to an arrest of the heart, but a heart attack is not equal to a cardiac arrest, because someone can be having a heart attack and still, their heart could still be pumping. I will talk about that in a second, okay? So it's all about the heart is totally stopped. It's not pumping at all, okay? And this is why we do chest compressions. So do we know, okay, this is a really important question. Do you know which other organ we worry about when the heart stops? Does anybody know the answer to that one? Absolutely, Jen, you're amazing. Yes, the brain. Okay, so we do worry. And Shabir, Dad, amazing guys. Yeah, oh wow, you guys are already there. Okay, I'm not going to do the video because I think last time I did the video, it's a bit long, but it's fine. It just shows that there's a guy that had a cardiac arrest at school and someone knew how to do it and it saved his life. And is exactly what we're doing today, is thinking about that. Why are we learning these skills? Okay, I want to ask the question and I want you to write in the chat. say these people had cardiac arrests outside of hospital. If someone has a cardiac arrest in hospital, you have the hospital staff there, they're going to try and revive the person. But we're not working, well, I work in a GP surgery, and majority of you guys probably don't work in the hospital, or maybe you do. So if it was outside of hospital, how many of those 10 would have a cardiac arrest at home? Can someone tell me, out of 10, how many of those would have a cardiac arrest at home? Just a guess a number out of 10. 2, 3, 8. Okay, so someone's hit the jackpot there. Mo and user 871, absolutely bang on, and 209. Thank you very much for your answers. Absolutely. So 8 out of 10 cardiac arrests outside of hospital occur in the home. That's shocking. How many of us, I'm a doctor and I know the skills, but if I wasn't a doctor, where would I get that skill from? And would I really know how to do basic life support if I didn't seek the training? That's shocking, isn't it? And I put a number 4 out of 10 there. Apparently, according to the Resuscitation Council, only 4 out of 10 adults are confident with delivering basic life support. And this is why I'm so passionate about it, guys, delivering this training. And I do it for schools. I do it for children aged 9 and above. I want to make it normal for people to know how to do this. So then I do this little scenario. My son does the demo. But essentially, the Resuscitation Council have asked us to look at this. Early recognition and call for help, which we have done. We've done part of that, haven't we? And early CPR, early defibrillation, and post-resuscitation care. Now, I don't want you to worry about the post-resuscitation care because that will be done by the hospital and the ambulance crew. We have to do the majority of the links. And it's all about early everything, because that brain needs oxygen, okay? So now I'm just going to quickly recap on what we've just done, and then I'm going to do the CPR bit for you guys, okay? So early, so is it safe to approach, which we mentioned? Are they responding? If they're not responding, okay, then you call for help. I mean, you're going to call for help initially anyways, but then you call for double help, okay? And maybe call for a defibrillator as well. You want to check for breathing, okay? And how you check for breathing, we just said that. So when someone's collapsed, their muscles are all relaxed. The tongue hits the back of the throat and blocks that airway. By doing head tilt, chin lift, you are unblocking that airway and allowing some air to go through. They might start breathing at that point, and then you may want to put them in the recovery position. But then you can also you look, listen, and feel for breathing for 10 seconds. Okay. So if they're breathing normally, yes, you do the recovery position. I mean, if we were all together right now, I'd make you practice the recovery position, but we're not going to do that right now. But you can see the position that woman is in the picture. And I did mention agonal breathing as well. Does anybody want me to talk about agonal breathing quickly again, or are you guys all right on that one? So it's when they're breathing weirdly, they're not really breathing normally, and they're just taking breaths which are not regular. That would be considered that would be considered agonal breathing. Would you put them in a recovery position if they're not breathing? No, because if they're not breathing, you are going to start CPR. Okay. So now, guys, I don't know what's going on here. Why it's doing that? Oh yeah, call for help. Now we're on the second link. Early CPR, cardiopulmonary resuscitation. Okay. Agonal breathing. Someone's written that. So real quick first, before I start the CPR and show you CPR and how you do it, why do we do chest compressions? Now, firstly, we just said the heart has stopped altogether, okay? Sorry, I've got a bit of a cold. So the heart pumps blood all around the body, and the normal rate that the heart pumps is between 60 and 100 beats per minute in an average individual. This is a resting person, okay, not someone who's exercising. And what does that do? I mean, the blood carries oxygen, nutrition, fighter cells to all parts of the body, and also helps to get rid of waste through the lungs, kidneys, and your bowel. And it also makes sure that you are at the right temperature. I mean, the heart is amazing, isn't it? I just absolutely love the heart. And the fact that it's electrical, wow, it's just unbelievable. Okay, I just find it, I'm just in awe of it. So what is a cardiac arrest? Now, if you have a look here, someone said on the chat that a cardiac arrest is when someone has a heart attack. Now, a heart attack can lead to a cardiac arrest, but it's not the kind of and it's not it's not the only reason. A cardiac arrest happens when there are abnormal pulses overriding your heart's natural rhythm. It's an electrical issue, okay? So something happens to the electricity in the heart. A heart attack, as you can see here, that is a blood vessel. The blood vessel is now blocked. And that is where blood vessel is blocked by, cholesterol and all these different things, then the blood can't go past that. So any tissues that need that blood will start to hurt and not have any oxygen and start to hurt and actually start to die. I don't want to say the word on the live, but yeah. So that's why you're getting that discoloration there. And that causes pain and the heart attack pain that people describe, okay? So a heart attack is a common cause, like I've said, of a cardiac arrest, but not always. And whoever said brain is amazing. So the brain is the first organ to be affected, which is why everything being early is so important, okay? So blood flow to the brain and other organs. And you can see here, we need to do chest compressions at a rate of 100 to 120 compressions per minute and at 5 to 6 centimeters deep. Okay, right. I'm going to turn the camera around because I'm going to show you guys the chest compressions on the dummy. Okay, if you can share the live, that'd be great. Okay, thank you for joining. Whoever's joining the live, I hope that you're finding it really useful. And I hope you're learning. Let me just see here. Someone's written here, Lauren Baker. Thank you for joining the live, Lauren. My uncle had a heart attack a few weeks ago. Oh, gosh. I mean, it's a real thing, isn't it? So do you do CPR? Yes, you do. I mean, if they are not breathing, their heart has stopped, you just do CPR. It doesn't matter what the cause of the cardiac arrest is. You just do the CPR. Exactly the same as anybody else, whatever the cause is. Okay. Right, guys, are you ready? So my dummy is quite special, okay, so because it's got a little circle there to show me where I need to put my hand, okay. So what I normally do, I don't know if you guys remember from physics, pressure equals force over area, okay. I don't want to go into too much Einstein stuff, but essentially you're going to try and use just this part of your hand to touch the chest at the lower part of the breastbone. Because if you can see, I'll show you the picture again in a second, the left ventricle or the left side of the heart is closest to this bit here, and we're going to try and pump that area, okay. So you need to put this bit of your hand over there and keep it on the skin. Interlock my right hand is my dominant hand, so I put my right hand on top, and then you're going to try and you're going to keep your hands arms nice and straight, nice and strong. You're going to have yourself over the body. You're not going to be not sitting here and trying to do this. You're going to be right next to the person, okay? Your body's going to be over the person, so it gives you maximum force, maximum pressure on the chest to try and make that 5 to 6 centimeter depth compression. So then what you do is you interlock. You're going to minimize, not doing this, not putting your hand all the way over, because that's just not going to work, okay? You're going to interlock. You're going to keep minimal amount of skin on the chest. So arms interlocked, straight, and you're going to do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So you do 30 chest compressions, okay? And after 30 chest compressions, you then go on to do 2 rescue breaths. Now, this is the bit where people get a little bit funny about it, because if you don't know the person, if they've got vomit on their mouth or their mouth is bleeding, you may not want to do rescue breaths. In that situation, there's 2 ways of doing this now, right? So some people have a pocket mask. Now, my pocket mask is in the car, so I haven't got it right now on me. I might get it for next time. But you can use a pocket mask, which is essentially a plastic piece of equipment which you put over the mouth, and it has a mouthpiece where you can blow into the mouth of that person, so you're not technically touching their lips with your lips. The other option is, if you really don't want to and their mouth looks damaged or whatever, for whatever reason, you can just continue chest compressions. It's more important to continue the chest compressions. However, However, having the rescue breaths there is really important because you want good quality CPR. Is about oxygenating the blood as well, not just pumping it around the body. So if you want to do a rescue breath and you know the person and you want to do it, okay, fine. When we were checking for breathing, what did we do? We did head tilt, chin lift. By the way, if you are putting questions on the chat, I may not be able to see it because I'm doing a demonstration. Okay, so sorry about that, and I will come back to questions if I can. So you do head tilt, chin lift again, okay? When you've done the head tilt, chin lift, there's a difference. When you're checking for breathing, you're just doing that and you're checking for breathing. When you do the rescue breaths, this time, someone mentioned pinching the nose. You do, because if you don't pinch the nose, whatever air you're blowing into that person's mouth is going to come out the nose. Okay, so you pinch the nose and then you do it over 1 second. Okay, so you cover the mouth and you do 2 rescue breaths, and then you go back onto doing the chest compressions again, minimal hand, and you do it at 30 to go. Okay, guys, so I'll just do 30 now. And you keep going back and forth, What you want to do, you've already called someone to get a defibrillator, okay? You've already called for help. And say, for example, you are on your own. You are on your own doing that. It's very, doing chest compressions it's quite tiring, especially if you have to do it for like 5-10 minutes. It can be really, really tiring. So what situations, actually, let me go to oh my God, I've got 85 new messages. I am so sorry if I missed your messages. Ignore the technique is perfect. Okay, I didn't even read the message about the technique. So, when would you stop CPR? Say you're on your own, when would you stop? Does anybody know? Write in the comments, guys. When you're exhausted, absolutely. We're human at the end of the day and we can't go on and on just doing chest compressions and rescue breaths. So if you're exhausted, you can stop. Say the ambulance men arrive, exactly. If they start breathing, absolutely, brilliant. And also if the defibrillator tells you to stop the chest compressions as well, okay? When help arrives, when they put the defibrillator on, you guys are amazing. I am really impressed. Until ambulance arrives, absolutely. So, you're doing that, say, somebody's bought you the defibrillator. You're so excited now. You're like, oh my goodness, we've got to check this heart now. What is the rhythm of this heart? Okay, so this is a defibrillator. It's a trainer one, so it's not going to shock me, so don't worry. I wouldn't give it to children if it was real right now. So all defibrillators have 2 buttons. They all look different, can look scary. Someone said to me, oh, can a defibrillator start a car battery or something like that, like something weird? I was like, no, I don't think so. But yeah, it has 2 buttons, an on button and a shock button. They might look scary, but they are so simple to use, okay? So what I'm going to do, I'm going to switch this on, right? Okay. And it's going to ask... iPad. It's going to ask... Patient's bare chest. So it's going to ask me to... Plug-in pad connector next to flashing. It's quite analyzing heart rhythm. It's quite demanding. Just ignore it for a second. Okay. Do not touch the patient. So ignore it for a second, guys. I'm just gonna show you what this does. So on the pads, shock advised. Yes, they do. Hoodie type, they do. The one that I've got doesn't actually come with scissors because I'm just doing it on dummies. But the defibrillator packs come with shavers as well because some people might have a hairy chest, and the pads won't stick if somebody's got a hairy chest. But also, one thing to remember, if someone's had a heart attack, they also sweat as well. And their skin can be quite damp and sometimes pads don't stick. So, it may come with a towel too to dry the skin, and you can shave the skin if they've got hair too, and cut their clothes off if you need to get to the chest. So on the pads themselves, it will show you where to apply the pads. So you've got 2 pads, okay? One says to put it, okay, I'll show you now this way. So one says to put it on the side, and I'll actually show you with the camera in a second now, 2 seconds. So and one on the patient's right side. So if I use my camera, and I'll show you exactly where. Oh, thank you, Moody Muslim. That's very kind. So you can see here where it says to apply the pad. So the pad is applied, okay? And also here. Because you got to remember, when I do the shock is going to go through one pad to the other. So you want to try and get as much electricity to go through the whole heart as possible. And when it's analysing the heart as well, if I had this, like some children were putting it there, and I was like, I don't think that's going to work. Is you've got to put it near the axilla area here, okay? So that when it does shock, it shocks right through from one pad to another. You're trying to get as much of the heart, have the electricity go through as much of the heart as possible, okay? Sorry guys, you can see my face again now. Okay, let's have a look. I don't even know what the time is. I don't want to make it too long because I don't wanted you guys to just learn quickly about this. So we've now got the pads on the chest, okay? We've now got the pads on. I might turn it like that, so I don't know what the best position is for you guys to see. So now I've got the pads on. This is such a good piece of equipment because it just tells you exactly what to do. So now I've pressed the green button. I'll switch it on, okay? And
analyzing heart rhythm.
By the way,
do not touch the patient.
While it's doing that with there, do not touch the patient. Okay, fine. It's telling me what to do.
Shock advised.
It's asking to shock. So obviously it's asking to
charging.
Shock. So we're going to charge and then
stay clear of patient.
No one touched the patient, not even with your pinky.
Deliver shock now.
And then
press the orange button now.
Orange button lights up. You press.
Shock delivered.
The shock has been delivered.
If needed, begin CPR.
And it actually gives a metronome to help guide you how fast to do it. So you can actually follow, and then you just keep following what the AED, what the defibrillator is telling you to do. Okay. Someone's asking, if someone has a pacemaker, you still do it. You still do this. You still apply the pads. I mean, in a pacemaker situation, the pacemaker is usually on the left side, but you're not applying the pad there. If someone's gone into cardiac arrest, that pacemaker is not working. So you're going to do basic life support, exactly the same as everything else. Okay. So when, for example, if you watch my video of the demo that is on my profile, my son is doing it, and I take over chest compressions. While I'm doing chest compressions, you apply the pads. You do not stop chest compressions or whatever you're doing, because okay, if they got piercings, they might burn a little bit, but that's not the main issue. The main issue is getting the heart going. So what happens is you mustn't stop chest compressions unless the AED asks you to do that, okay? So it's so simple, guys. Someone's collapsed, they're not breathing, call for help, 999, ask for a defibrillator, start chest compressions, 2 rescue breaths, 30 to 2, 30 to 2, apply the pads, check the rhythm, follow the defibrillator. It is so, so simple, okay? Now, what I'm going to do now, 2 seconds, I'm going to just show you another thing that I've done here. And thank you so much to everybody who's joined the live. This is really good. I'm hoping that you guys are really benefiting from this. So it's a bit of a summary. So 30 chest compressions, 2 rescue breaths, and you just keep going round and round until you get help. And people mentioned, okay, well, it costs about 300 quid. What costs 300 quid? Okay, remember 100 to 120 beats per minute, or chest compressions per minute, and at 5 to 6 centimeters depth. Now, what if the heart's on the right side, but the left ventricle will always, well, that side would always be in the middle anyways. What I would say is some people talk about, fracturing ribs. Normally on call, they recommend hands only. Yeah, so sometimes hands only CPR. Like, how do you mean hands only? You can only really do your hands, isn't it? There is a machine that they have that can do CPR, like it's an automated machine. And that's probably a really good machine because it doesn't tire or anything. And as humans, we can get tired quite easily, isn't it? But remember that head tilt, chin lift, and you pinch the nose. That's really important to remember. Okay. Yeah, the Lucas Thumper. Okay, cool. I didn't know what the name of it was. And also, some people don't feel comfortable doing rescue breaths, and that's fine. Just continue chest compressions. But remember, good quality CPR is if you can get rescue breaths in there as well. Oh, thank you, Angie, for sharing the live. So in terms of giving them epinephrine, hoodie hype, usually in the community, like we don't have that equipment. That's usually, if that's needed, then you would actually be, that would be the hospital and the ambulance team. Okay, I will show the chest compressions in a second again and go through it. So when can you stop chest compressions? Exactly like we just said, when the defibrillator asks you to stop, when expert help arrives, if you have someone who can take over, you're tired, and the person wakes up. And if they wake up, you put them in the recovery position. Okay. And I just want to quickly run through. Okay, so I want people to put in there in the chat, why do we give chest compressions? Just a short answer if you can. Oh, thank you. So why do we give chest compressions? Can anybody write in the chat for me? To get the heart pumping. Exactly, because what has the heart done? It's arrested. It's stopped. Absolutely. To circulate blood. Thank you so much. And how many chest compressions to how many rescue breaths? Can anybody remember that? Thank you. 30 to 2. Brilliant, guys. Brilliant. Oh, and if they're breathing, what do we do? Oh, yeah, keep it. Yeah. So what if they're breathing? What do we do? Rescue, recovery position. Okay. Yeah. So it depends. If it's agonal, you're gonna assume that they are already, absolutely, guys, that they're in cardiac arrest. You're not going to assume that's normal breathing. What organ is affected first when the heart stops? We've also mentioned that. That's the brain. The depth, guys. Does anybody remember the depth of the chest compressions? Can anybody remember that? So the 5 to 10, so it's 5 to 6. Excellent. Okay. Even if you remember 5 to 6, that's honestly, that is like, is gold information. And what rate do we aim for when somebody is given chest compressions? Oh, don't worry, smile. What rate? 120. So from 100 to 120, a bit more than what the heart is normally pumping for us. Okay. And rib fractures, okay, there is a question, there has been a question before about fractures of the rib. And when somebody is in cardiac arrest, their muscles are all really, really kind of, just like the tongue is relaxed, the muscles are relaxed. You actually find when you give chest compressions to someone who's collapsed, it's easy. If you did it on a person who's awake or just not really unconscious, it's quite hard actually. But then people have said, okay, if we fracture ribs, what happens? And I wouldn't worry about that. The most important thing is that you give the good quality chest compressions. Fractures may break. No, fractures may happen, of the ribs, but that doesn't matter. Fractures will heal. And yeah, absolutely. Yeah, so Dr. K, don't worry about fractures, just do the CPR. Absolutely brilliant. So really quickly, I'm just going to flip the camera, and we're actually, guys, we're nearly done. We are on the 3rd chain of survival. We've done early recognition and call for help. We've done early CPR, and we're now on early defibrillation. We've actually done the early defibrillation, but I'm just going to show you in the presentation what it was. So these are all the different types of defibrillators you can get, and you can see they all look quite scary a little bit, maybe like car batteries, I suppose, or battery starters or whatever. But essentially, they all have 2 buttons that you need to know. They have an on button and a shock button. Okay. Yeah, I can try and go through children's CPR next time. I've actually got little baby dummies as well. So maybe, inshallah, on the next live. Okay, yes, and hoodie type, it's so important. If you ring 999, sometimes not sometimes, they can tell you where the defibrillators are. Okay, so the heart is electrical. I just still can't get over that. I think that's amazing. And you can look here. That is the pacemaker of the heart. It's in the right part of the heart, guys. And that's where the electricity originates from for our heart to pump. And wherever the electricity is traveling, that muscle is going to contract, okay? So something happens to that electricity in the heart, and the heart then stops for some reason. So that is what can lead to a cardiac arrest. So the AED, or the automated external defibrillator, is what can recognize what has happened to the heart and what rhythm it is in, okay? So I know you don't need to remember any of this, but there are two rhythms whereby the AED will say shock, and there are two rhythms whereby the AED will say no shock. You don't need to know what they are because it doesn't really change. You just have to follow what the AED is saying, okay? So there are two shockable rhythms, two non-shockable rhythms, and you just follow the instructions. If no shock is advised, you just continue CPR and wait for help, okay? But if shock is advised, you deliver the shock and follow the instructions and wait for help. So there is a bit of talk about safety when you're using the automated external defibrillator. So follow the instructions carefully. If a shock is being given, do not touch the patient. I mean, the children I teach say, oh, not even with your little finger. No, do not touch, because you have to remember it's electricity, and also your heart is electrical. So someone who's touching a defibrillator that's shocking another person could go into cardiac arrest themselves. So just be really careful, and only stop chest compressions when the automated external defibrillator tells you to. Okay. So I just want to know how many of you were listening. So how many shockable rhythms are there, guys? Yeah, it'd be so yeah, exactly. 2. And how many non-shockable rhythms are there? Exactly, guys. And if no shock is advised, you just keep doing CPR and just follow the defibrillator, okay? And then that's it. That's actually it, guys. We have done all of basic life support. It's that simple, okay? Let me just flip the camera. I can actually see the comments now, okay? What did you think of that presentation? Was that quite easy to follow? Do you think that if you saw somebody collapsed, that you could potentially approach them and do CPR? I mean, I think there's no substitute for actually doing it and practicing, which is why I do this, you know, I always try and do the practical sessions with the children, because I want them to practice and feel what it's like to do a chest compression, because actually techniques differ. And I'll show you something that's really funny, because when I actually ask patients about children to do chest compressions, there's lots of different ways that people get it wrong. So we can talk about that quickly before I end the live. Let me get rid of the defibrillator pads a second. Okay, so we'll look at that in a second later. So, as I said, you use that part of your hand, you put it here at the bottom part of the breastbone, because you're trying to get to the left side of the heart, okay, the left ventricle, which is closest to the breastbone. And some people, they do this. Now, remember, for pressure equals force over area, you're not going to get good chest compressions if your hand is fully touching the skin. It just needs to be that area, okay? So you're going to very controlled. Some people do this, like that. That's not a good chest compression. You're not giving a good force. Your elbows have to be fully locked straight, guys, locked straight. And do you see what I mean? And you don't tire as easily when you do it that way as well. And the other thing is not jumping off the chest. So I sometimes get people doing this. See, they're coming off the chest and they go in different places. No. Imagine that your skin is stuck to the chest. Your hand is stuck to the chest. But you need to come all the way back up, because you need to let the heart refill, then press again, then let the heart refill. Because if you do this, or if you do this, you're not letting the heart refill, okay? So you need to... You're letting the heart refill back again, and you're doing the chest compression like that. Does that make sense? Because someone asked me about that. Okay. So, I think that's it, guys. Does anybody have any questions before I leave the live? I don't know what time it is, actually. I think I did a good time, didn't I? What if someone has spinal surgery? I mean, if somebody has collapsed, you're not going to worry about all those things. You're just going to want to get their heart pumping again, okay? You're very welcome. Thank you so much. I will try and do this a bit more often because I know I'm slowly getting people who are starting to follow me, and I think I want to spread the word as much as possible. But I do other lives on health promotion and things like that as well. So hopefully we'll be doing other things related to medicine and health in the future. Do you put cover on the face when someone's unconscious? I have no crime stories. And I think Shoaib, I don't know whether you are on the right live. Oh, Jazakallah, thank you so much. I hope that you guys found it useful. If I haven't answered your question, it's only because I'm demonstrating. I've sent an invitation to somebody and I have no idea what that was about. I'm still new to TikTok, okay, and the live, so ignore that, guys. So if you want to, do you ever find doing CPR you can't really do it too hard, but I think you'll know when you're doing it whether it's a good technique or not. But it's about practice. If you can find a centre near you that does CPR, that'd be really good. Yeah, you can vote for, or you can actually go to join St. John Ambulance. There is a waiting list for that, depending on where you are in the country. Kids CPR next time. Okay, I mean, kids CPR, are we talking about babies? Are we talking about children? Because children who are like maybe 10 or 11, they would have the same, you would treat them the same with the chest compressions. Babies, okay, yes, I've got baby dummies I can do. And for babies, there's 2 fingers on the chest. Yes, you're absolutely right. Okay, how do I connect? That's another live, guys. So I'm going to go now. Thank you so much for listening. And thank you so much for asking questions and sticking to the end. And thank you for the follows and the likes, guys. Take care. Have a safe evening. And if you ever need to do CPR, at least you'll have some idea. Okay. Bye. Thank you very much, guys.